RNs and CRNAs to provide patients with the health care they need. And this is a blessing for me that something I feel so passionate about is also shared as an issue that the speaker, Jose Oliva, feels passionate about. If you recall, during his opening remarks, Speaker Oliva challenged us to look for innovative solutions for the healthcare crisis. And with anesthesiologists and physician shortages in general on the horizon, we must find ways to allow patients to have access to health care. If we can achieve some cost savings, that's going to be fantastic as well. And never lose track of where you are in your notes. Oh, here we go. Forgive me. I want to thank everyone for coming, and I'd like to hand it over to Dr. Jose Castillo.
Thank you, sir. Did I give you my notes about last week? Yes, maybe you have it. I don't have it. I promise I don't have it. Thank you, Representative Pigman. Good morning. Good morning. On behalf of Florida's more than 6,000 certified registered nurse anesthetists and student registered anesthetists, we also thank House Speaker Oliva for being our champion for so many years. We are very excited. My name is Dr. Jose Castillo III. I am an advanced practice registered nurse, specifically a certified registered nurse anesthetist, aka CRNA, with a PhD in instructional design and technology. I am here today on behalf of the Florida Association of Nurse Anesthetists, and this is our CRNA Day. Welcome. My personal journey to become a CRNA started when I completed my Bachelor of Science in Nursing in 1994. I practiced nursing for almost 11 years, and with my nurse anesthesia education in 2005, I completed it in 2007. According to the American Association of Nurse Anesthetists, CRNAs obtain an average of 9,369 hours of clinical training in preparation for their career as an anesthesia provider. This education and training include mainstream anesthesiology textbooks in a structured curriculum and clinical residency. CRNAs practice in all settings where anesthesia services are rendered. CRNAs play an important role in Florida's healthcare system. Anytime you have visited a hospital or had to undergo a medical procedure, we have been by your side. From the minute you are brought into a surgery room, throughout your procedure, and all the way through recovery, as we manage your vital signs to make sure that you, as our patients, are safe and comfortable throughout our care. Nurse anesthetists like myself have been providing anesthesia care to patients in the United States for 150 years. Did you know that we are sometimes the only primary care providers of anesthesia care in rural areas? To maternity patients, in the U.S. military, and in many medically underserved communities? Medical studies examining states that do not have supervision requirements found no difference in patient safety or healthcare quality. To the contrary, numerous studies have found improved access to needed anesthesia services in the opt-out states, evidence of lower healthcare costs, and no differences in medical outcomes. We cannot thank Speaker Oliva and Representative Pigman enough for their unwavering commitment to seeing this bill through. We thank them for sponsoring this very important piece of legislation to modernize Florida's laws and allows CRNAs and all of the highly qualified APRNs in the state of Florida working to fully utilize their skill set and practice without burdensome and costly supervision regulations. Patients' interests are best served by a healthcare system which many different types of qualified professionals are available, accessible, and working together collaboratively. My fellow Floridians, if you're watching or listening and you still do not understand what CRNAs and APRNs do in our great state, on a day-to-day basis, I challenge you to reach out to us or to any CRNA or APRN in your communities. Ask us. Let us break down these walls and provide a bridge with his unanswered questions and misunderstandings about the true value of CRNAs and APRNs to our state's future. Thank you very much for this opportunity, and we are open for questions. Thank you.
No questions? Thank you all very much. We appreciate this opportunity. How you doing?
I'm good. What would you say to the people that say that they question that these folks are not medical doctors, they don't have all of the skills? What would you say in return, particularly to a governor who seems skeptical?
I would say when you look at what their experience is on paper, what their training is, it's quite extensive and exhaustive. And when you look at studies that compare the outcome between those two categories, nurse practitioners, CRNAs, and physicians, our outcomes are equivalent. That doesn't mean that we don't have more to offer each other, but on the average study done, outcomes are great.
And you're not performing surgery.
I am not.
But you are a doctor.
Yeah.
And so you're one of the few doctors that doesn't oppose it.
You know, I practice in a rural area where we have a huge need and we have a shortfall of providers to give it. I'm looking for more hands to help me lift the burden.
All right. Thanks, Terry.